Welcome again. And so if you did have the opportunity to attend our last talk last week, you are familiar with Dr. Muna. If not, welcome. She is currently working as a GP oncologist at Sunnybrook Health Sciences Center. She is the lead of the follow-up and survivorship program at the Louise Temetry Breast Cancer Center at ODAC. She is also an assistant professor at the Department of Family and Community Medicine at the University of Toronto and an affiliated scientist at Sunnybrook Research Institute. So her research interest is in breast cancer survivorship, quality of life related research, and sexual and women's health. And so we also have with us today Jennifer. Jennifer is a breast cancer survivor. She is a board ambassador for After Breast Cancer and is a patient partner with Unity Health and St. Michael's Hospital. Jennifer is also a standardized patient at the University of Toronto and a patient teacher in the Humanism in Medicine program at U of T. Perfect. So now, Muna, I think if we go to full screen view, I think the slides should not run away on their own. So fingers crossed, it should work now. So Thank you again for that. I'm sorry about those speedy slides, but welcome and thank you for being here. And over to you for the presentation.
Thank you, Vanessa, and it's a pleasure being here today again with our breast cancer survivorship series and our second topic about mental health and well-being. I know that when it comes to mental health, there's a lot to say. However, for this presentation, I'll try to give you an overview about most common psychological issues that breast cancer survivors experience. Before we dive in, I just wanted to let you know that this is a safe space. Everyone is welcomed and respected. Feel free to put your questions, comments, suggestions on the chat box. And so let's get started before any further delays. So I'm Muna Al-Kaifi. I'm a GP oncologist and breast cancer survivorship expert. I run the survivorship program at That Cancer Center, Sunnybrook Hospital. I'm also a member of the Patient Information and Survivorship Committee at Cancer Care Ontario. I just wanted to let everyone know that this particular session has not received any financial support, and I don't have any conflict of interest to declare today. My overall goal is to advocate for high quality, evidence-based and individualized survivorship care for people who've been affected by breast cancer. So let's start our topic today. I'll just start first with a definition by the American Society of Clinical Oncology. So they defined survivorship as living with, through, and beyond cancer. But some patients who get to the beyond cancer stage say that they were unprepared for the toll that this experience would take onto their mental health. So, as I mentioned, there are many psychological issues when it comes to survivorship phase. The majority of patients struggle with mental health after completion of treatment. There are many issues that patients may experience, including fear of recurrence, anxiety, depression, post-traumatic stress syndrome, survivor guilt, as well as issues related to work and children. There are actually many reasons for having these psychological issues after completion of treatment, including uncertainties in life, fear of recurrence, concerns about family and finances, also hypervigilance about new symptoms, changes in self-perceptions as well as body image, also some physical symptoms like chronic pain, menopausal symptoms, including hot flashes, can affect also mental health, as well as some side effects from some medications, for example, tamoxifen, that can also have a negative impact on mental health. Let's start first with fear of recurrence is one of the most common, I would say, psychological issues that breast cancer survivors may experience. It's defined as the experience of worry and concern that cancer might come back. Um, Breast cancer survivors may experience intrusive thoughts, anxiety, and irritability that can last for specifically days and weeks prior to their surveillance visit, as well as prior to their also like imaging, like mammograms. For the most part, some of these symptoms are like they can subside after receiving negative results, for example, negative mammogram. There's also a very interesting term called scanxiety, which is basically an anxiety that many patients may experience when going through imaging scans following their cancer treatment. So before getting a scan, and also till they get the results, patients may experience intense anxiety, depression before getting the results. And this is kind of a well-known phenomena. So let's keep going. So basically, Sarah is just sharing her experience about fear of recurrence and how she has a lot of anxiety prior to her imaging. And she mentioned that this can be perfectly normal. And I just wanted to let patients know and attendees who are attending today that some degree of anxiety is expected. Like anxiety is a normal reaction for breast cancer survivors. However, these symptoms can be really very severe sometimes, and in that case you need to seek help. So if your example your symptoms are impacting your quality of life, in this case you need to seek help from your oncology team. Some of these symptoms include, like, if you are experiencing any fear of recurrence, for example, any minor aches or coughs or headaches bring a strong fear that cancer has recurred. Also, if you have recurrence, if recurrence is a constant worry, that may also impact your sleep, or you may have no desire to spend time with your friends, or this intense anxiety may affect your interest in continuing usual routines, as well as when it's affect your concentration at school, at work, then in this case, that this fear and this anxiety is really affecting your quality of life. In this case, you need to seek help from a psychotherapist or even from your oncology team. I know that some of the patient may also avoid surveillance visits altogether because of this anxiety, and some patients, on the other hand, may request more imaging or may request more outpatient visits. Now let's move to talk about anxiety. When I talk about anxiety, is more than just fear of recurrence. It's more about generalized anxiety. Now you are anxious about everything and anything, and that can also impact your quality of life. I know some patients would start to have anxiety after their cancer diagnosis, but some of the patients, they already have anxiety, and after their cancer diagnosis they have even more anxiety, and their anxiety might heightened. Um, Symptoms of anxiety including worrying thoughts, again, insomnia. Some patients may also experience physical symptoms, for example, chest pain, shortness of breath, chest tightness, and all of this can also impact their quality of life. Now let's move to depression. Depression is not, honestly, is not very common compared to anxiety as well as fear of recurrence. It's less common among breast cancer survivors. However, it is associated with twofold increase of all causes of mortality. So women may have not good, I would say women may have worse outcome if they have also depression along with their cancer diagnoses. Also, just to keep in mind, it's not only yourself. Sometimes some medications, including like tamoxifen or ovarian suppression medication, these medications can cause mood swings and can affect your mood overall. So you might also speak to your doctor if this just me being anxious and depressed, or there's another cause. For example, my medication. Sometimes there's also other medical conditions that can cause depression. For example, if you have hypothyroidism. So it's good to bring this to your oncologist as well. Again, symptoms of depression includes, for example, unusual sadness, decrease in pleasure and daily activities, decline in functioning, significant change in your weight or appetite, and ability to sleep and fatigue, as well as loss of energy. Let's move now and talk about survivor's guilt, which is again very common. It's a complex psychological condition that is described as a sense of blame for the diagnosis, loss, or grief. Feeling that that they have done something wrong that can be never corrected as a result of having survived cancer. And I do have a lot of my patients specifically, they carry a lot of guilt and they always feel that they like did something wrong, that's why they had this cancer diagnosis. And this can actually lead to mood disturbance. some Sometimes actually this feeling, survivors can use this feeling to give back to the community by doing more advocacy activities. Post-traumatic stress disorder. It's also, I wouldn't say it's very common, but a lot of my patients told me, I think that I have minor PTSD from the cancer diagnosis as well as treatment. So we know that cancer diagnosis can bring PTSD symptoms. Some women, they call it post-traumatic growth disorder, and women may experience flashbacks or intrusive thoughts and memories, feeling numb, detached, or experiencing sudden fits of anger. And I know a lot of my patients told me that they still have flashbacks when they're sitting on their chemo chairs, when they are heading to the operating rooms, when they are going to just coming to Sunnybrook. They do have a lot of these flashbacks as well as intrusive thoughts, which can bring some also sadness and a lot of intense fear. So again, if you have these symptoms, it's good to talk to your doctor about them. Unfortunately, cancer diagnosis can not only affect only breast cancer patients, it also can extend to their family, children, spouses. So it's very important to also make sure that we also address these their concerns. We know that children may have feelings of uncertainties, anxiety, as well as isolation. And we know that depending on the child age, cognitive capacities, their strength and gender, we know that females may a little bit be affected more, and that also and that's why if you have any issues, we can always reach out to, like for example, at Sunnybrook we do have like patient and family education center. So always seek help if you think that your also children may be affected by the cancer, by your cancer diagnosis. Let's move also to spouse or significant other or also caregivers. We do have available data and we do have evidence that caregivers, including significant other, may experience stress, anxiety, as well as depression. The way to go around this is mainly by sharing thoughts and feelings about cancer experience of both the patients and caregivers. It's found to decrease the stress or and depression. Also, your caregivers can seek help from from their family doctors. And I know there's many programs out there in the community specifically about caregivers. Again, your cancer diagnoses as well as treatment side effects can also impact your work. And we know that many patients have issues when they're returning back to work. It can be difficult, and patients, especially some patients, will continue to have physical and psychological side effects after completion of cancer. Even like the psychological issues can impact your work and your overall function. I know that a lot of my patients shared with me is because of brain fog. They cannot concentrate again at work. Also, they cannot perform well. They now have a lot of like psychological issues. They do not feel that they're the same again, and people do expect from them that they do really better after they come back from work. So I would still encourage you, if you think it's hard to go back to work, to talk to your oncology team, or also social workers can really help you to navigate this process. Also, we know that there is kind of disability plans that you can apply for if you think that you are not ready to go back to work, or it can be kind of short, gradual transition to work. I know that Wellspring, they do have many workshops about how to return back to work. Now, I'm just going to talk briefly about treatment, and then we're going to open it up for your questions as well. Jennifer will talk about her experience. In terms of treatment, I just wanted to let you know that everyone is different and everyone has different preferences, values, and perspectives. But it's good to seek for help and just find what is really right for you. We know that I think this first step is to talk to your oncology team, especially if you have fears about recurrence. Just talk to them, like get more information. Just be informed about what are the next steps, what are the risks of recurrence, and what are the symptoms to watch for. For example, in terms of imaging, just ask them like when is the next imaging, and just get more information. That some answers may help you to relieve some of your anxieties. Also, we know that some physical symptoms, for example, hot flashes or like brain fog or chronic pain, all of this can actually affect and impact your mental well-being. So please just feel like go and just talk to your doctor. Like, I do have chronic pain, and this is affecting my mental well-being. So treating your physical symptoms can also improve your psychological and mental health. There are many treatment options. There is pharmacological and non-pharmacological treatment. Let's start with the basic thing. I would say I encourage most of my patients to exercise. Yesterday, I just had a conversation with one of my patients, and she told me exercise are the only thing that kept me going and helped me a lot in terms of my mental health. And we know, based on evidence, that exercise can improve your mental health as well as improve your outcomes from breast cancer. So there are many reasons why to exercise. We know that exercise can also reduce your risk of recurrence, improve your body image, physical function. The recommendation is moderate intensity physical activity, 3 to 4 times per week, as well as resistant exercise twice a week. Last seminar, we also talked about healthy diet. I would recommend most of my patients to focus mainly on fruits and vegetables, especially if you have fatigue. Then high energy boosting food can also help you avoid processed food, red meat, and fat, and also limit your alcohol intake. Self-care is also a key that you can also try by yourself. For example, just know more about yourself, like your self-care skills, if you're eating right, if you're drinking enough, if you're sleeping well, do you need if you're smoking or if you're drinking excessive alcohol. Also, just know more about what do you love to do, and just try to incorporate more time as well as room for these activities in your life. In terms of non-pharmacological treatment, we do have evidence for psychotherapy. I know that not everyone likes to talk to someone and share their experience with someone else, but we know psychotherapy is really effective, as well as there's a lot of evidence, and it's actually evidence level A evidence, which meaning that this is really very effective, even is considered to be the first choice for breast cancer survivors. Other things that you can try for sure, like relaxation exercise, yoga, we have some evidence, meditation too, specifically cognitive behavioral therapy. Massage, music therapy. Now we are, this is more kind of more evolving, but we do have some evidence. Also, just seeking help from family and friends. We know that also support groups, for example, even like such small webinars, or even like the groups that's arranged by that is organized by Wellspring can be really very a good platform for you to share your experience and know more about survivorship phase. Also, acupuncture and journaling, we do have some evidence for those. I just wanted to elaborate more about having a psychotherapist. I would say just seek help from your oncology team, especially if you are in a hospital. For the most part, they do have a psychology team that they can refer you to. If you are in the community, you can ask your family doctor, and ask for, and your family doctor, even the social worker, can provide you with a list of psychotherapists, or even like resources in the community. I'm sure that there are many resources in your community. Just ask and try to explore these support system, and see what is really works for you. We know in terms of psychotherapists, they can help you to cope with cancer diagnosis, can help you to feel less overwhelmed and more in control, probably manage your anxiety and depression, also cope with some side effects, for example, pain and fatigue, and even self image. Because, for example, I know some of my patients, their main issue is self image, which can be treated. For example, we can refer them to a plastic surgeon. However, they need to talk to someone like a psychotherapist to help them to process their emotions. So, psychotherapy is always effective. I do have here a list of support groups that you can refer to and see which one is suitable for you. There's Sisters in Scars, Flat and Fabulous, also kind of Wellspring, Canadian Cancer Society. I don't know, especially for people who live in Ontario, Bounce Back Ontario, they offer a free psychotherapy for Ontarians, and also there are many programs, for example, in Wellspring. Also, I know that there are some in Princess Margaret Hospital. So for sure, there are many programs in their community, and I would recommend that you try to explore these and try to advocate for yourself. I do have also my website. I know in the last seminar, some of you asked me about my website. So it's www.breastcancersurvivorship.net. I do have some information about side effects in general, but for sure you can refer to any other websites. I also provided you with a list of resources last time, and I'm happy to provide it even today for today's audience. Let's move to medication, just 2 or 3 slides, and then we're going to open it up for Q&A. In terms of medications, I know that not a lot of breast cancer survivors wanted to try medication. However, I would encourage women who are like having really severe anxiety and depression, that is like that last for a long time, to consider antidepressant, for example, SSRI or NSRI, because that will help them in terms of their mood, along with psychotherapy. There's also gabapentin, which can also help with anxiety and pain and hot flashes, so you can it can be also effective. Again, try to talk to your team with regards to other physical symptoms which can impact your mental well-being. For example, constant pain for sure can affect your mental well-being. So ask if there's any medications that you can take. And also keep in mind to check drug interaction, especially if you are on tamoxifen. We know that there is many medications that interact with tamoxifen. So antidepressant is a reasonable option, especially if you tried psychotherapy, if you tried a lot of other modalities and interventions, then you can consider antidepressant. So talk to your doctor, and they can always start you with a lower dose. I know some of my patients would be a little bit worried about, oh, I don't want to be on antidepressant forever. I would say you can even try it for like 6 months to a year and see if you want it to continue, because some women, they do really well and we can always wean them down. But if you are very anxious and depressed and that affecting your quality of life, I think also adding antidepressant to other along with other interventions, non-pharmacological interventions, can be helpful. Just to conclude, a majority of breast cancer survivors report psychological issues, so you are not alone. It's very common. And anxiety is, as well as fear of recurrence, are the most common psychological issues among breast cancer survivors. I would just recommend you to make sure to incorporate physical activity and healthy life, which can help your mental health. For sure, there are many non-pharmacological and pharmacological interventions, and the key is to seek help. And I wanted you to know that you are not alone. A lot of my patients told me, we don't feel that we are the same. I don't feel like I am the same person. I'm now more anxious. I cannot enjoy life. So please seek help. You are not alone. And just try to advocate for yourself. And it's okay to not be strong all the time, or to have these struggles after cancer diagnoses, because cancer cannot only affect you, can affect a lot of people surrounding you, as well as affect many aspects of your life. It's not only like your mental health, mental, physical, sexual health. There's a lot of your work, your family, your kids. So this, it can affect many aspects of your life. So now I guess that's that from my end. This is kind of more a brief overview about mental health during survivorship phase. I wanted to hand it over to my friend Jennifer, who she's a breast cancer advocate, and she always, I guess, tells me that breast cancer diagnosis is more like a mental battle than anything else. So I just wanted to hear more from Jennifer today about her experience, and you can tell us more about that. Thank you.
Thank you, Mona. You actually say it a lot nicer than I do. I use swear words. I say it's more of a mind bleep than a
Okay,
physical
okay.
one. Because it is. I mean, if you think about it, we're diagnosed and we're right into surgery, right into treatment, right into scans. We have about this much time to process it and not knowing what's going to come next. I think speaking with your oncologist is very important, because cancer care needs to be holistic. It has to look at your mind as well as your body, right? It's not just the tumor. When I speak to med students, and I remind them that when we sit down in a chemo chair, we bring everything that's going on our lives into that chair. Our families, our work, our stress. I mean, I did it all backwards, right? You know this. I did it right 2 weeks from diagnosis into chemo, right into radiation, right into surgery, and right into surgery again. And then it was done. And I know I'm not unique where you're going, now what? I couldn't focus. I couldn't read a book. I couldn't I couldn't think straight, or I could think straight, but I couldn't focus. I couldn't read a book. Absolute anxiety about it coming back. Now that I've been released from my oncologist, it hit me that this would be about my 6-month checkup, and I haven't seen her, and I want to scan. And of course, they'll say, well, you've had so much radiation, we shouldn't scan you, or the resources needed. But, the anxiety, I have more anxiety waiting on the results or not being scanned. It's my biggest fear. There's no question I have PTSD. It turned my entire life upside down. And, I'm 7 years out, and I still have the fits of anger. I'm off all the drugs. When I first went on exemestane and Zoladex and pushed heavily into menopause, my God, was I a raging maniac. All of a sudden, I would be screaming fire because I was so angry. And the anger was what I was going through, as well as the chemical change. I think also, you get hit with feelings of anxiety. I get hit with feelings of I feel more PTSD, but I don't feel myself. I'm heavier than I was, and now I only have one breast. I feel desexualized. Right afterwards, when I was in chemo, I didn't have hair, but I could wear my clothing and I looked like me. And so I could plow through it. But at the end of it, I didn't see me. And it took me so long to see me again. And, so it's a loss of confidence. Like, I was extremely confident before I was diagnosed. I was tiny, I wore great dresses, I looked fabulous. And now I'm not me. It's a very, very, very hard road. And that impacted my mental health greatly. I know it seems superficial, but I imagine I'm not the only woman that's sitting here going, yeah, I get it. When you spoke of kids, my daughter has OCD, obsessive compulsive disorder. She was diagnosed, she was 10 when I was diagnosed. She was diagnosed with OCD at 15, and it's all health related. It's all anxiety about health relation. And I have no doubt some of that came from me, from seeing me go through this. And they offered, they kept asking, did she want to talk to a social worker, my oncology team? And she didn't, she wouldn't. I took up this, was like, oh yeah, bring me the social worker. Anything to try to ground me. But it took me, 2 years to read a book? It took me, it's taken me, I'm still not completely accepting of my body. I think I said this last week. Someone asked me, do I have a harder time because I have one breast or because I'm missing a breast? I'm depressed by the idea of dating, how not to be fetishized or looked at as weird, except 1 in 8 women will go through this, but only 25% will have mastectomies. So I think I hit a lot of what you said. They tried me on gabapentin for my arm because I have cording. I didn't like it because I was at that point in chemo fog and I felt stupid and it made me feel stupider. But my biggest problem was, not having secondary insurance, can't afford psychotherapy. So if you have access through your healthcare team and your hospital and your oncologist and it's free, take it. Because none of us should go through this alone. I talk to way too many women through after breast cancer in different programs where the story is a little different, but the story is kind of the same. I know I'm not unique. My mother likes to remind me of that. But, it's for me, it was getting past the negative feelings. And it's taken years and they're still there. So it's always a struggle. Once a cancer patient, always a cancer patient. Anything more than a cold, I know it's back somewhere else. Anytime I look in the mirror and I'm having a bad day, I just see one breast. I don't see the whole woman, Jennifer, who's alive in front of me. And so it's a juggling act to bring yourself up, but also to feel it at the same time. Those are my struggles. So that's what I'll say, because I know there will be a lot of questions and I rather prefer people ask questions and listen to me blabber on.
Thank you, Jennifer. I think you nailed it and you expressed a lot of the struggles that most of breast cancer survivors, they go through, I don't want to say everyone, but I hear this all the time in my clinic. And I wanted to let women who are attending today that you are not alone. So, and please seek for help, seek for help. And it's all of these are not superficial. All of these are serious issues related like to self-image, to your self confident, your like how the way you see yourself, and all of the side effects from cancer treatment, like brain fog, the things that you used to enjoy and not enjoyable anymore. So all of these, you should put it in mind and just ask for help. And thank you, really, Jennifer, for being vulnerable and sharing your story today. And I cannot say thank you enough to Jennifer. She's always a good role model. And I can see there's a question about to you, Jennifer, about can you discuss the impact of performing advocacy on your mental health? It's a great question. I don't know if you can
I didn't
maybe
see it. It is a great question. Advocacy makes me feel better. Advocacy makes me feel stronger. It makes me feel heard, that what I'm going through, if I have to scream it, I'm going to scream it. But I also now advocate for other friends who have chronic diseases, whose doctors won't listen, because there's nothing more debilitating after cancer than not being heard. I know my body in a lot of ways. I'm not an oncologist, so I do have the fear it's back, but I also know when my body's not me. So I find empowerment through advocacy. I speak to third-year medical students on their surgical rotation, and it is so empowering to talk to young med students, the next generation of doctors, and push them on holistic medicine to treat the person, not the disease. So for me, it's been a very, very positive and a very healing process. But you've got lots of questions, Muna.
Okay, so yeah, maybe Benita can help us to
Yeah. So I just wanted to come on just to say thank you so much, Jennifer. It's always so profound when we hear you and patients share their experience, because it is very, very validating in a community that is maybe going through similar emotions, similar journeys. So it's very, very validating and very powerful to hear your story. So thank you so much for sharing that. And Dr. Muna, thank you for going through. I know we had a lot of information to cover in a short period of time, but I think you did a great job at really touching at a couple of different aspects that do affect mental health. So just wanted to say thank you for that.